So let's look at some of the complications of diabetes. One of them is the eye complications, what we call retinopathy, and they also tend to get cataracts. Then in the mouth, you have periodontal disease, and so patients with diabetes, they need regular dental checkups. Coronary artery disease, and so patients with diabetes, they always periodically need an ECG. And then they also have kidney complications, what we call nephropathy. And this starts with especially loss of proteins in the urine, what we call albuminuria. And then in the lower limbs, the legs, they'll have numbness and tingling sensation. They may have ulcers, and also they may have ulceration. It's also the mental complication of diabetes because of its long-term effect. Many of the patients with diabetes, they may have depression, and so we also need to keep checking on their mental status and also helping them up cope with the complications. Then we also have brain complications. The risk of cardiovascular accident is real in patients with diabetes. Then, especially in men, we have erectile dysfunctions, and healthcare workers should always keep checking on this because sometimes patients may not be able to talk about it. And then peripheral neuropathy, abnormal sensations in the feet, and the loss of the sense of pain, touch, and this leads to complications that patients can wear shoes that are not well fitting or that are too tight on them, which can cause injuries to them. Then diabetic foot leading to ulceration and amputation. Many of our patients have lost their limbs from diabetes. Then there's the self-care by the patient, which is very important for patients to know. One is the patient need to keep a close monitoring of their sugar, then monitoring their body weight so that they are not getting more weight, and of course they are getting adequate nutrition. There's the importance of foot care, personal hygiene to prevent infection, living a healthy lifestyle. That will include the diet, nutrition, or adequate nutrition, and also physical activity. So we need to identify targets with the patient, the kind of diet they're supposed to use. What are your targets for the control of the diabetes? So that you are all talking about the same thing. And of course, in the self-care issue, also there is the issue of smoking. For those patients who are smoking, then you need to encourage them very much to stop smoking, because smoking increases the risk of cardiovascular events, more than diabetes, more than hypertension, more than obesity itself. It's a big risk. Then let's talk about foot care, a very important issue in the management of patients with diabetes. One, patients should always check their feet daily. Two, make sure that they wash their feet on a daily basis, and after washing their feet, then they need to purposely clean in between the toes, because that wetness causes fungal infection. Fungal infection opens the feet to bacterial infection, then you have development of diabetic foot, and many patients lose their feet out of that. Then they need to protect their feet. This is by wearing shoes always, which are well-fitting, not tight. And when patients acquire new shoes, then they should progressively make sure that they gradually break into them. Then it's always advisable that they have socks to keep warm and also to prevent injuries. It's always good to keep their nails short, because long nails will increase the chances of injuries, and they can also injure themselves with the long nails as they walk, if they are walking barefoot, but which they should always avoid. So on the follow-up, for newly diagnosed patients, it is always good to see them fortnightly, then monthly after their sugar has been controlled, and then you have quarterly reviews. They need annual reviews by the ophthalmologist to check on their retina. Continuously, we need to maintain health education and also self-examination. In the quarterly review, You want to check the patient's weight, the waist. You want to check the blood pressure. You want to check their kidneys and especially urine, and check for albumin. You want to do a feet examination and especially check the sensation, check for ulcers. Then annually, you want to check the blood pressure. You want to examine the feet. Also check the sensation in the feet. Following up on the glucose level. Of course, follow up with the glycated hemoglobin and also the visual acuity. So, in the continuous management of diabetes, patients need to be sure that they are having a healthy diet, which is providing adequate nutrition and also is providing the necessary micronutrients. They need to have regular exercises, and when you talk about exercise, at least we are talking about at least more than 30 minutes, more than 3 times in a week, and if possible on a daily basis. Monitoring of the blood sugar, continuous use of their medication, and also follow up by the healthcare team. Thank you very much. I appreciate your listening to me.